or those are asking they are late, they are not, I am not seen them. ऐसा ही होता है. एनीवे सेशन 3 मैंने दोनों सेशन अभी इस तरीके से पूरा कंप्लीट डिटेल में दिया है. उसका अमृत आपको अभी मैंने दे दिया हूँ. एवरीथिंग आई टोल्ड यू, आई नेवर केप्ट एनीथिंग हिडन. एवरीथिंग इज ओपन, सिंपल एंड प्रैक्टिकल. सेशन 3 आई एम वेरी प्रैक्टिकल ओरिएंटेड. रिजल्ट मिले देंगे, चमत्कार मिलेगा, नमस्कार करेंगे. नहीं तो कोई आपके पास टाइम वेस्ट करने के लिए नहीं आने वाला है. पेशेंट हो या आपके रिलेटिव हो, आपकी पर्सनालिटी आपको डेवलप करना है. आते ही मैं आपको सर्व विज्ञान में लेके जाने वाला हूँ और आपको 3 दिन प्रैक्टिस कराने वाला हूँ, जिससे कि आप यहाँ से जाने के बाद में एक अलग ही दुनिया में चले जाएंगे. आपको जो चाहिए वो मिलते रहेगा. बिकॉज भगवान शंकर and Parvati both had a discussion about how to make the kalyan of this universe. Parvati asked Shankar. Shankar said, only control their breath is control everything in their life. Health, wealth, money, everything, everything. How it flows, we are going to see in Sarvigyan with medical numerology, with medical astrology. We are going to give the idea of that also, concept, this introduction to you. You can develop gradually. It's not one day knowing, but 3 days you have to change. Session 3. Now my dear friend, session 3 we have covered masturbation. Most of the time younger age group patient comes to us, sir, I done lot of energy loss, now I am important, I want to go, I have marriage. I'm not homo. I'm a straight, heterosexual. I like the girls, but I can't perform. This is not a one-day story. You have to go step by step. First, have Master Johnson said, don't go immediately. Take some week or 10 to 15 days period to know each other. Immediately you want to be on bed is not possible to have the things. So it is, my dear friend, very important to teach them, and you are going to learn each and every aspect, how the mind, brain, physics works together. Now homosexuality is oral and anal sex most of the time. It's a very important thing. Homosexuals, anal intercourse, unconsummation, where unconsummation married. I have a couple, and that is noted that in a worldwide, more than 7 years after marriage, everything is normal. They are straight couple and they married, but they can't perform because female partner is not allowing to touch the finger. How she will allow you to have intercourse? That's the problem. That is again vaginismus case. In vaginismus case, need psychological aspect, counseling aspect, even shockwave therapy helps, muscle relaxation help. Most of the people also use the what you call Botox. Some doctor asked me, sir, Botox therapy kaise kare? So Botox for relaxation, muscle relaxation, you can use that time, but it is a very costly therapy. You know Botox, even 5 ml Botox, what's the cost? 10,000, 15,000. And your fees, you added 5,000 more, then what will be the patients? Is it too much? Or one time relaxation is over? No, you need the repeated relaxation. How you will be possible? The better way, we will teach you in simpler way in our hands-on training program. There is must even what you have to do and what not, we will learn. And sometimes the dyspareunia is painful because of bacterial infection or fungal infection. It is very common. There is no one in India they have no fungal infection. Maybe in any time fungal infection जल्दी जाता नहीं, बहुत चिपक के रहता है. उसको 3 मंथ टुगेदर देना पड़ता है. 3-4 महीने, 7 महीने, 8 महीने उसको कंटिन्यूस करो तो फंगल इन्फेक्शन जाता है. और along with this fungal infection, if you use increase the result orientation, homeopathic some preparation, how to go to the homeopathic remedies, potentization, repertorization and all, you are going to learn. You must learn. That we will show in a patient, or we will take any patient, make any patient in the group and we'll take how to go ahead for other diseases and other things. How they get the results. It's very faster. I'm telling you, Homeopathic is so faster than the allopathic injection. You bring any asthmatic patient, within 5 minutes I will give them relief without giving any steroids, without giving any injection, aminophylline drip or adrenaline or anything what we are using previously. Nowadays nobody is using that, or any inhaler. Only giving LM potency, simple water with that potency, 1 into 50,000 the patient gets relief. But that is not cure. Cure needs some times. And that is the remission program we are going to start. Remission of asthma, remission of diabetes, remission of hypertension. If you are not doing, we'll go. My 35, 40 years experience, you take it in your clinic and earn. How do we have the plan for that? And patient will be yours only. You are the treating therapy doctor's name will be mentioned, though the prescription goes the WNHO head office, but that will be the on your clinic, your name and everything will be there with association with WNHO, helping to the people. That is the only motive in that. And reverse their diabetes, reverse their blood pressure, so you can change the economy of pharmacology. Nowadays, most of the doctors have worried. Even I have seen, I'm seeing previously 10 to 15 patients in a day, hardly seeing 3 to 4 patients. Everywhere patient is ready. Only surgical line of treatment. And after a few years, surgery will also done by robot. You are only technical, mechanical, engineering pattern doctors. In one doctor will run whole institute. Bigger, just the whole medical college. One person tick, and all a robot and everyone is doing it. Bas. That will be the future way. So come forward, learn the techniques, methods, use this. That is a wellness coach are earning more than what people, all doctors are earning. So become a scientific wellness coach. That is, we are now program of clinical wellness program. Clinical, they are not clinical doctors. They are doing it. We are the clinical doctors. Why not you do it properly and help the society? That is the future of futuristic medicine. That is my feeling. When I repeatedly, 7 to 8 times I visited US, mostly I'm there at Atlanta, and most of the Google and every back office, most of the even these things are the Atlanta having their back offices. And my son is that computer engineer and all. They have the Google friend and they discuss that, well, future is very different now. Everything will be on people going ChatGPT, prescribing medicine, but other things, most of the things they are not prescribing, because allopathic is very simple to prescribe. And that's why the most of the people go and patients go and buy the medicine and no need. And even buy online, nobody comes. All hospitals will be empty. Only big hospital, corporate hospital will run in future. Within 10 years that you can see. Remember this thing, my sentence. So be careful, come forward, learn the various techniques and methods, use it, help the others. So you will be remain continuous in the field. Now, my dear friend,